In many homes, danger does not arrive with noise. It arrives quietly. A woman prepares dinner for her family, unaware that a tiny visitor has already contaminated the food supply. Days later, fever begins, then weakness, then bleeding symptoms appear. This is Lassa fever, a viral hemorrhagic illness that spreads silently and becomes deadly when not recognized early. And in Lassa fever emergencies, nurses are not just caregivers. They are infection control protectors, clinical observers, and often the first barrier between survival and an outbreak. When a suspected Lassa fever patient arrives, nursing responsibility begins immediately at triage. Lassa fever often starts like malaria or typhoid: fever, headache, weakness, body pain. But nurses must recognize the red flags early. Early suspicion protects the patient and everyone inside the healthcare facility. Delayed recognition increases both mortality and the risk of infection spread. The most critical nursing responsibility in suspected Lassa fever is infection prevention and control. The virus spreads through body fluids: blood, urine, vomit, and respiratory secretions. The nurse must immediately isolate the patient and apply strict protective precautions. Personal protective equipment is not optional. It is life-saving. One exposed healthcare worker can lead to a hospital outbreak. Protecting yourself means protecting other patients and the entire community. Lassa fever can worsen rapidly, so careful clinical monitoring is essential. Nurses must watch for bleeding signs, breathing difficulty, confusion, dehydration, and organ dysfunction. Vital signs must be checked frequently. Small changes often signal disease progression. Accurate documentation allows rapid treatment decisions and helps track deterioration early. There is no simple cure for Lassa fever. Supportive nursing care often determines survival. Nurses maintain hydration, monitor fluid balance, support oxygenation, and prevent shock. Fluid management must be precise. Both dehydration and fluid overload can be fatal in viral hemorrhagic illnesses. When prescribed early, antiviral medications like ribavirin can improve survival. Nurses play a critical role in safe preparation, accurate administration, and close monitoring for adverse reactions. Timing is everything. Delayed treatment greatly increases mortality. Lassa fever creates fear and stigma in families and communities. Nurses provide emotional reassurance and educate relatives on safe infection prevention practices. Education reduces panic and prevents further spread. Lassa fever is dangerous, but early recognition, strict infection control, and skilled nursing care save lives and prevent outbreaks. Nurses are the silent shield protecting patients, healthcare teams, and entire communities from deadly infectious diseases. I'm Nurse Succinate. Watch the next video on early warning signs of viral hemorrhagic fevers every healthcare worker must know.